What could possibly be wrong with your eyes today? Yesterday, we got the warnings again and again and again. Don't look at the sun when the eclipse is going on, because even though it's a 98% coverage, there's still plenty of light there to do you some big hurt. Dr. Ernest Bhend joins us now, Charlotte's Eyes, Ear, Nose, and Throat Center. Appreciate you joining us here today. What would be one of the first indications to somebody that perhaps they spent a little too long lingering in the light?
Yeah, if they start seeing some loss of vision in their central part of their vision, or like a blurry or kind of like a blind spot, those would be things we'd want to know about. Probably want to have an eye doctor check that if you started noticing those kind of symptoms.
But is there any sort of burning that goes along with it, or any sort of pain?
Not necessarily. Some people have reported the eye kind of hurting after they've been looking at the sun for a little bit, but just at the time they're doing that. But the retina, the tissue in the back of the eye where the light receptors are, there usually are not pain receptors back there, so it's usually not a painful experience as far as that goes. Usually it's just the vision loss that patients would notice.
Okay. Now, if somebody did glance too long there at the sun, is there a possibility of two different kinds of damage? Is there temporary damage as well as permanent damage? And if so, how do we tell the difference?
Yeah, so the temporary changes, it would probably just be the blurry spots that would last maybe a few days and then would go away with some time. The permanent damage is going to be the blind spot that just doesn't go away, or blurry spot that just doesn't go away after, a few days' time. We're recommending that if patients are experiencing those kind of symptoms, they definitely want to get in and have their eyes checked by an eye doctor. There are some tests that we can do to actually see if there is damage there. And we can actually look into the back part of the eye and see changes from that damage if it occurs.
What kind of damage would you see? What would it look like back there?
When you look at what's called the retina, and that's the tissue in the back of the eye that has the light receptors in it, I tell patients it kind of works like the film in the camera, if you imagine the eye works like a camera. When we look in the back of the eye with a special lens, we can actually look at the surface of those tissues. You can actually see some changes in the color of that retina tissue. It'll look like even yellow spots or kind of some brownish black spots if there's significant damage. And then we can do some scans of the retina, almost like taking an x-ray of that retina tissue, and look at it in cross-section and then actually see breakdown of those cells if it's present there.
Wow, it's almost like browning a roast a little bit.
Yeah.
Is it possible, I've got about 35 seconds left here, is it possible to go completely blind from looking at the sun?
You could, technically. It's unusual. I mean, usually people, if they're looking at the sun and it causes damage, it's just going to be a blind spot in the center part of the vision that's left there. But if you looked long enough, it could potentially damage it. We've had a lot of patients ask, if I looked at it just a few seconds, is it going to damage it? And typically not. Usually it's only if you've looked at it longer than, say, 30 seconds that it'll actually cause that damage.
That takes a real stud to be able to hold their eyes there that long. I'll tell you what. Dr. Ernest Bhend helping us out here from the Charlotte Eyes, Ears, Nose, and Throat Center, CEENTA.